All right, everyone, welcome to our caregiver stress management presentation. My name is Matt.
My name is Jeremy.
My name is Tammy.
My name is Amy.
And I'm Ben.
So this project is an interdisciplinary partnership between UCI School of Nursing, the Division of Geriatric Medicine and Gerontology, and OC Public Authority IHSS program. And we just want to thank our professor, Jung-Ah Lee, for providing guidance for us throughout this project.
So here's our outline for our presentation. And first, we'll be talking about what is burnout. So burnout is a state of mental, physical, and emotional exhaustion, and it's caused by sustained work-related stressors. Some stressors can include things like long hours, pressure of quick decision-making at work, caring for patients with poor health outcomes, and overall staffing issues and workplace turnover. Next, for the signs of burnout, the most immediate signs of burnout are feeling disengaged and detached from work. Some other signs can include constant tiredness at work, compassion fatigue, feelings of unappreciation, work anxiety, and an overall lack of enjoyment at work. And lastly, the importance of recognizing burnout. On a micro level, if burnout goes unchecked, it can lower an individual caregiver's performance level and thus their overall quality of life. And on more of a macro level, burnout can heighten the desire to leave jobs or caregiving entirely and can again lead to increased turnover rates, and it can also harm the overall quality of caregiving. So now that we discussed what stress is, what stress and burnout is, what the signs of it are, and the importance of recognizing it, Jeremy will go ahead and discuss multiple ways that we can manage these things so that we can, as caregivers, take care of those that we love better.
So like Matt said, I'm going to be talking about a couple of ways that we can manage our stress, and that's through exercise and finding hobbies. So the first point I want to make is just get up and get moving. You can incorporate safe exercises throughout your day to burn off stress and keep your mind and body sharp. According to the CDC, moderate exercise can improve your thinking and cognition and reduce your risk for anxiety, depression, and other diseases. Like Matt said, we want to keep our mind and body sharp, keep it at our A game so that we're able to provide the best support that we can for our clients. So a couple at-home exercises that we can do, stretching, walking, lunges, doing jumping jacks. This is a very minimal list. There's a bunch more exercises that you can do as long as you're staying safe and as long as it's comfortable for you. So like I said, as long as you're moving your body, it doesn't matter what you're doing, as long as you feel comfortable and safe doing it. Just make note of your own limitations and work with your own body. So another thing you can do to manage your stress is just do something fun. We just want to prioritize yourself. So make time for yourself and do something that you enjoy. That's picking up a hobby such as, cooking, knitting, photography, playing with your pets, listening to music, or reading. And next, Tammy will be discussing a couple other stress management techniques through sleep and meditation.
So I'm going to be talking about relaxation and sleep. So as everyone knows, sleep is important. It is a dynamic activity. You need it to survive, and it is important for health. But why? So research shows that while rats normally live for 2 to 3 years, those without sleep survive only about 5 weeks on average. So sleep helps to keep the nervous system functioning. So without it, too little sleep can leave us drowsy and unable to concentrate the next day. It can also lead to impaired memory and physical performance. And sleep also just helps us to keep us growing. So what are the benefits of sleep? So some benefits of sleep include boosting your immune system. So it's better than vitamin C, preventing weight gain, strengthening your heart, bettering your mood overall, increasing your productivity, increasing exercise performance, and improving your memory. So what are some sleep habits that we can do to basically help us to sleep better? So some of them include just if you can't fall asleep, just get out of the bed and do a quiet activity such as reading or journaling, but only doing it without the light on. Only use the bed for sleep and sex so that your mind associates your bed with only sleep and just resting. So that means no work on the bed. And then most importantly, and lastly, just turning off electronic devices at least 30 minutes before bed. And using that orange light instead of blue light on. Something else we can do to relax is meditation. So in meditation, it is important to pay attention to our breath and build those muscles of attention and mindfulness and just remain in the present moment. So I'm going to be walking us through how to meditate. So first of all, just take a seat and find a place to sit that feels calm and quiet to you. And set a time limit. So if you're just beginning, it can help to choose a short time, such as 5 or 10 minutes. And then just close your eyes and notice how your body is feeling. You can sit in a chair with your feet on the floor. You can sit loosely cross-legged, or you can kneel. Those are all fine. Just make sure you are stable and in a position you can just stay in for a while. And then when you're noticing your body, just go through all the different parts. So if your shoulders are feeling just very stiff, or you feel pain in your foot, just going through your entire body and noting how each body part is feeling. And then feel your breath. So following the sensation of just your breath going in and out, but notice when your mind has wandered. So sooner or later, your attention will leave your breath and just wander to other places. And when you notice that, it's perfectly fine. Just go back to returning your attention to your breath. And be kind to yourself. So don't judge yourself or obsess over what your thoughts are. Just come back to your breath and your body. And lastly, just close with kindness. So when you're ready, just gently lift your gaze, and then if your eyes are closed, just open them again and take a moment to just notice any sounds in the environment and notice how your body is feeling in the present moment. And just notice your thoughts and emotions. And that's it. That's the practice. And next, Amy will be talking about how to set boundaries.
So it's important to set realistic goals in taking care of our stress management as caretakers. There's a very common saying that you can't pour from an empty cup. And that is because there are a lot of times when we as caretakers feel too tired to take care of ourselves. And that's why it's important to prioritize your own medical needs, because you can't take care of others if you yourself are not being taken care of. And that's why it's important to understand that you can't do everything by yourself as much as we would like to or wish we could. If you're tired or fatigued, it's okay to ask others for help. And it's important to understand that we need to spend our time and energy wisely, because there are only a certain amount of hours in every day. And so if we find ourselves feeling overwhelmed, it's very important to stop what you're doing, and very similar to what Tammy taught us with meditation, and ask yourself, what do I need in this specific moment? And if it is taking a little break, if it is needing a snack, go ahead and do all of those things, because it'll help you re-navigate your day and focus on what you had planned for the day. Now, most important though is understanding that, as a caretaker, you are entitled to establishing the boundaries that you need for yourself and maintaining your emotional and physical well-being. If someone keeps insisting that they want you to come out to a party and you need to decline the invitation, it's okay to say no and say that you need to take care of your loved one or your client. And if they keep insisting, it's okay to stay firm to your commitments because you are entitled to those boundaries. And to kind of help to say no, it's very important to use what we call I statements. Now, with the I statements, that is a way to essentially keep those boundaries while not sounding accusatory. So, for example, if you need to be home at a certain time, or if you want to make sure that there are no phone calls after a certain time, then instead of saying, oh, you always call late at night and you wake me up and, I can't sleep because of you, it's much better to say something like, I have to be home at 9 o'clock and I cannot be reached on the phone through text or phone calls because I have to make sure that I can tuck in my loved one at that time frame. And with that, it's really important to communicate your responsibilities, not just with your friends and family, but also maybe perhaps with your loved one or your client that you are taking care of. If you find yourself that you're, dropping all of your hobbies and interests, the things that Jeremy said to do when you're feeling stressed, then it might be time to redefine what your responsibilities are. Let's say, for example, if you can only take care of your loved one on the weekends, then work with others to make sure that that work isn't overbearing on you and have some other people help you. That way you don't feel guilty for having to say no. And it's also important too that, if you are a caretaker, you're hired as a caretaker, or you are hiring someone else to take care of your loved one, then you set those boundaries before you start that caregiving, mainly because it's a lot easier to ease on restrictions rather than creating more as time has passed. Now, with that, we talked a lot about needing help and asking for help is okay. So with that, we're going to pass it on to Ben to talk about where to find that support.
Thank you. So why is social support so important? And this has been really extensively researched, and across all literature, it's been found to be a significant predictor of both mental and physical health outcomes. So things like ability to cope, depressive symptoms, anxiety, quality of life overall, and as a significant protective factor against disease. And there's two primary types of support that we're going to look at: instrumental and emotional support. And so instrumental support is being helped with something tangible. So you helped me pick up my children from daycare. You helped me with a shopping trip to the grocery store, et cetera. And emotional support, like it sounds, is having someone listen to us, to engage with us, and to talk to. And optimally, we have a mix of both of these kinds of support so that all of our needs are met. It's really important. So there's a few different kinds of ways to find support or community. And there's a lot of different resources to look at depending on what your needs are. And if you have social media or Facebook, one very popular option are Facebook groups. And so if you search Alzheimer's and Dementia Support Group on Facebook, there's several very large groups, and they'll be linked in the resources where you can post, respond to other people's posts. And it's a really helpful way to build community around caregivers of folks who have Alzheimer's and dementia, and to do it in a really accessible way because you can do it from your computer or from your phone when you're at home, et cetera. Also, faith community. So if you're part of a faith community, can be a really helpful place to get connected with other people, to find support. Also, religiosity and spirituality have found to be really strong protective factors as well. And other community organizations, so Alzheimer's Orange County, other mutual groups that you might be a part of, hobby groups, et cetera, are all really important sources of support. And then finally, you can find a local support group. And so again, through Alzheimer's Orange County, which will be linked in the resources, there are support groups that meet. More and more are moving to Zoom. So you have the option, again, for accessibility's sake, of meeting via Zoom, or you can meet in person if you prefer that. They're offered in all kinds of different cities, different times, days of the week, et cetera. And they can be really good for building community and having support in that way. And then finally, mental health resources. And again, this is really highly researched, right? Therapy, counseling are really helpful for a lot of people, both in terms of improving any mental health symptomology you might be experiencing, but also just being able to kind of process and talk through different challenges that you might be in the midst of. Finding a therapist can be really challenging. And one of the most important predictors of therapy, of success of therapy, is the relationship with the counselor. It's more important than what kind of therapy, than how experienced they are, than really anything else. So it's really important to find a therapist who's a good fit. And there's a few different places that you can look. So therapy is very expensive sometimes. So Open Path is a really good option because all of the therapists who are on there have agreed to reduced fee services. And there's a range. Therapy Then and Psychology Today are also two very popular options. There's a lot of therapists you can look at based on geographic area. Again, for accessibility's sake, people that will meet with you to do therapy on video conference or in person. And then also all kinds of insurances, including Medicaid, Medi-Cal, taken by providers. You can search specifically for those providers there. And those will also be linked in addition to other resources for where to find a therapist. And again, really important to think about the impact of having a place to be able to talk through or process whatever challenges you might be experiencing. And similarly, to have a place to problem solve. So if there's a particular issue that's coming up in your life, practically speaking, can be helpful to have a neutral sounding board in that way too, to talk through challenges. And here are some of the resources that I mentioned earlier. And if you have any questions, please feel free to follow up with Professor Jung-Ah Lee. And thank you so much for your time.
Thank you, everyone.
Thank you.
Thank you.
Thank you.